it hurts. Okay, and basically you'll hear people my age, any age, 20, 30, 40, if they get pleurisy, it means that the pleural lining has become inflamed.
How's that not supposed to touch the rib cage?
It's supposed to, and the pleura is supposed to be almost frictionless because it's like one cell. This is, although it's hard to see, that's one cell layer thick. Okay, and basically it's supposed to be very frictionless. If it's not frictionless, okay, as in pleurisy, then you get inflammation and you get rubbing of one surface against the other. Okay, what's the next one?
Thoracic inlet.
Thoracic inlet is right here, okay, right there. Where you go? Did I just mess up my tie? Probably. Okay, thoracic inlet is where your neck and throat goes in through the chest. This is where things, when you swallow something too big, okay, gets caught in your esophagus. Or if you swallow something down your trachea, it gets caught right here or right here at the base of the heart. Next.
Mediastinum.
What?
Mediastinum.
Mediastinum. That's basically the whole central area. It's on the dorsal surface. This whole central area through which the trachea and the esophagus pass. Okay, and if you are young enough on your creature, you have the thymus that exists right in this central area. That's the thymus. You still have the thymus right now at your age, but within the next 4 to 5 years, you girls are probably regressing this faster than the boys. The boys usually grow until about in their early 20s. The girls usually by 16, 17, most of your baby stuff goes away by that time, okay? You're ahead of the boys physically, okay? And they'll catch up to you in their 20s, right? Except for Wyatt, right? Next.
What does that mean?
Diaphragm.
Diaphragm, right there. See? And by the way, it is like a thin piece of paper. Look how thin it is. That's pretty thick. In your cats, when we get the cats out again to decapitate them, okay, basically, if you feel the diaphragm, you see it's just like a thin sheet of paper. Next.
Right lung lobes.
Sorry?
Right lung lobes.
Right lungs. Which side's the right side? This side. Okay, there your right lobes. Okay, they call this caudal.
Can we put the rib cage down?
I'm sorry?
Can we get the rib cage down? There we go. Thanks.
Right side. This is the cranial, middle, and caudal lobe of the the right side. But there's also the lobe underneath. You humans, you guys don't have this, okay? This is called the accessory lobe, and it comes off of the right bronchus, one of the right bronchial tubes.
Caudal means what in an animal?
Hind end, towards the rear, okay? Here's the left. This is the anterior lobe of the left cranial lobe. This is the posterior or caudal lobe, okay, of the cranial lung lobe, and this is the caudal lobe. There's no middle lobe, okay?
Well, you said caudal twice, didn't you?
I'm sorry?
Did you say caudal twice?
Caudal lobe of the cranial lung, in other words, the one lobe that's in back of this single one. Okay, next.
Thymus.
I just showed you that. The thymus is right here, and it's right between. That's where all your T lymphocytes come from. You guys have studied that in AP Bio, right? Mm-hmm. B lymphocytes, T lymphocytes. Okay, good.
From a cat?
This is a cat, yes. Okay, next.
Esophagus.
Esophagus I've cut. Okay, right here. Yours is about this size, too. Yours is maybe a tiny bit bigger than this. And there are people born, there occasionally is a human born without an esophagus, okay, and they basically have to go to the back of the pharynx and put a silastic implant. They'll pull it into the back of the throat and run it all the way through the cardia of the stomach. We'll get into all this later. By the way, this is, what's this? Pericardial sac. Next.
Larynx.
Larynx. This is hard to see on the specimen, but see it here, you can feel it. Has the thyroid cartilage, the cricocartilage, and so on. It's the larynx. That's your voice box. That's where your vocal cords and the epiglottis closes over so food doesn't go down your windpipe. Next.
Thyroid gland.
Okay, here it is right here. See this little red thing right here? In the human, it's confluent from one side to the other. Thyroid, thyroid.
What
Okay?
about parathyroid?
You can't see them here, but the parathyroid in a human, there are 4 of them. Okay, they're right on the surface of the thyroid gland. They're the ones that help you deal with your bone situations. Yes, next.
Trachea.
Right here. By the way, you have the dorsal surface is a tissue. The cartilaginous ring is not complete. It's not a full circle. Watch what happens. When I breathe in, that's what happens. When I exhale, that's what happens. Okay, exhale, inhale, exhale, inhale. Same with your bronchial tubes. That's why bronchitis is so severe, okay, when mucus fills your bronchial tubes and causes bronchitis. What's the next one or last one?
That was it.
That was it? See you guys. Have fun.